Hi, welcome to the Pursuit of Truth. So I forgot to mention before on the last one about COVID-19 and China, as it seems to be, since they stopped the zero policy and everyone moaned about having that, and now suddenly it's burst over there. And the UK is very slow on thinking about transmission, almost like history repeating itself. So they've decided to follow America and some of Europe and put a ban in, but just like the UK, they've decided their ban's not going to be to the 5th of January. Of course, according to Sky News, there's another variant in the USA, and I don't think there's any travel restrictions there, so maybe more likely to come from the USA than China. But I just worry about history repeating itself here, because this is how it all started, wasn't it, in 2019? And also a bit to back up what I was saying before about Rishi Sunak hiding his head in the sand and governments lying from the professionals, nurses within inside the NHS saying that what's being told isn't true. So here you are, you can listen to this.
Is under pressure over the NHS and strikes. Rishi Sunak's spokesperson has given an update to journalists, the first since the holidays. Let's speak to our political correspondent Liz Bates, who's in Downing Street. And Liz, before we get to NHS and strikes, there's breaking news on pre-departure COVID tests from people flying in from China.
Yes, well, we did have some of this information a few days ago, but we've really had confirmation of it today from Number 10. The issue is, though, so first of all, I should tell you what it is. It is people travelling from China into the UK will be asked to do a COVID test pre-departure, and if they test positive, they will not be allowed on a flight to the UK. Now, we've known that for a few days, but we wanted a bit more detail from Number 10, given that it's coming in January the 5th, and they certainly need to get on with it, because that's in 2 days' time, but we haven't had confirmation yet on a few details within this plan. So what is still unclear is connecting flights, so people travelling from China via another country into the UK, will they be asked for these tests as well? People from Hong Kong, we're still unsure about that. There's a slight anomaly as well when it comes to people who arrive in the UK. So you get on a test, you've had a pre-departure negative COVID test. When you arrive in the UK, you are then asked if you would like to do a COVID test, and only a small sample of people will be asked to do that, and they can refuse to do that. The government says this is all part of a plan that is about being sensible and cautious, and really this is just about the lack of data coming out of China, not any real risks of any new variants of concern. So that is what we currently know about that issue of COVID testing. When it comes to NHS pressures, obviously the Prime Minister is really been asked a lot of questions about that and Number 10, because we've had so many stories about these terrible waiting times and people being treated in hospital corridors. Well, what the government is saying today is, first of all, that this is due to the COVID backlog. They were always expecting this to be a difficult winter. The first week of January is always very difficult as well. What's quite interesting about this, though, is the Prime Minister certainly seems to be almost staying away from this issue. We understand, first of all, this week there's no public events in the diary. He's not going to be visiting a hospital despite the pressures on staff and on patients. We haven't had anything publicly confirmed that the Health Secretary is doing anything this week either, so maybe slightly surprising. I think the general feeling as well is that Number 10 and the Department of Health may be taking the approach of waiting these pressures out, if you like. There's no expectation of any more big announcements on funding. They will certainly go ahead with previous funding announcements, and they want to see reform, of course. They're very thankful to all the staff, they say, working through these winter pressures. But apart from that, we're not expecting any big announcements, and it seems like the Prime Minister certainly is going to be staying indoors this week when he's working at Number 10.
OK, Liz, thank you. Well, the pressure on the NHS will continue to grow when thousands of nurses go on strike later this month. Campaign groups within the NHS blame years of austerity and real-term pay cuts for the strike, saying staff can no longer do their jobs safely. NHS psychotherapist Alia Bhatt joins us live from North London. Alia, thank you so much for talking to us. We hear so much, or we have heard so much about what it's like to be a patient within the NHS system. What is it like to work within the system?
I think it used to be a place where we would be able to work with pride and have a certain level of, I think, capacity to even consider what we're doing. I think now staff are incredibly depleted of energy, but also psychological strength. So yeah, it's not really a very nice place to work anymore, really and truly, because we are failing our patients every day, and we don't want to be doing that. And the reason we are having to do that is we are working within a system that is really crumbling and has been for a long time, and has been underfunded and has been partially privatized, and it's not working.
So what needs to be done to fix it? Because if you look at what the government say, they keep pouring money at it. £14.1 billion in the next 2 years. They say they've got a record number of personnel working in it, but it doesn't seem to be reflective in what people are telling us, the statistics coming out of this winter. So what needs to be done?
It's simply not true, is it? I mean, we've had 40,000 nurses leave last year. We went into the pandemic with over 100,000 vacancies. We certainly don't have a record number of staff members. In mental health services, we haven't seen an increase in staff since 2009, very long time ago, and the demand for staff has increased.
But that's what they say, Alia. They actually say that there's a record number of NHS doctors and nurses.
But that's just not true. And I think you'll also find that we don't have record funding. We've had consistently lower funding than in 2010. When you look at other countries with comparable economies, we're 20 to 30% underfunded. So we're not seeing, that this is simply not the case. With regards to staff pay, nurses who are demanding better pay, and I think the government should really think about listening to those demands so that we do have people working in the NHS moving forward. We don't have enough staff, and we certainly can't retain staff. Many are coming and leaving very quickly. So I'm really not sure where this, where the government thinks they're going to suddenly find lots of staff members. It's just not the case. We don't have staff, and they're not being paid properly. In terms of the 19% demand for pay increase, that's not even going to bring nurses back up to in line with inflation. It is still a pay cut. So that's just not the case, I'm afraid. I wish it was.
Okay, we're going to have to leave it there, Alia. Thank you so much for talking to us.
You're going to have to leave it there because you're talking too much truth, and Sky News, like all journalists, believe in the government, and when anything comes against them, they find it difficult to compute and believe. So that's it. Take care, take it, your best in peace.